Welcome to SBB University Caregiving Resources, brought to you by Seniors Blue Book, Resources for Aging Well. I'm Kathleen Warshawsky, and our guest today is Miss Emilia Bourland with AIPC Therapy. Welcome, Emilia.
Hello again. Thank you so much, Kathleen and Seniors Blue Book, for having me again for part 3 of our series, Transfer Smarter, Not Harder. Today, we are going to be going over the correct use of the right equipment, the basics that you absolutely need to know about how to work smarter and not harder by understanding the equipment that you have, how it works, and what doesn't work, so that you can be safer, lift less, and protect yourself and the person that you're transferring. If you are just joining us for part 3 of the series, I will introduce myself. My name is Emilia Bourland. I'm an occupational therapist. I have my executive certificate in home modifications from USC's Leonard Davis School of Gerontology. I have been an educator at Texas Women's University, teaching students in their Master of Occupational Therapy program, where I taught advanced clinical reasoning, hands-on clinical skills, and of course, basic and advanced transfer training. I am a published author in topics of stroke rehabilitation, as well as a health and wellness contributor to a local Dallas magazine. And I am the owner of AIPC Therapy, which is a mobile occupational therapy practice here in DFW. At AIPC Therapy, we are absolutely committed to making sure that our clients can achieve their goals, improve their outcomes, perform the activities they want, need, and love to do, and create safe, functional environments for them to do it in. So let's get into it here. Who is this best for? If you're just joining us for part 3, this is a training that is absolutely best for family caregivers and professionals who are committed to safety, who are committed to fostering independence in the people that they are caring for. Family caregivers and professionals who want to practice self-care, who want to protect themselves, and of course, family caregivers and professionals who are interested in new solutions to the transfer problems that they have. If you're here, there's a good chance that you are a caregiver who is feeling overwhelmed, overworked. Perhaps you are already in pain. Maybe you're worried about safety. Perhaps you feel like you haven't had adequate training, or you've been let down by training in the past, or you haven't had access to training in the past, and you just want to do what is best for you and the person that you are caring for. Quick little disclaimer, this is a general transfer training. It is not a substitute for individualized treatment for a health or medical condition. So if you are concerned that you or the person that you are caring for has a health or medical condition that requires individualized care or training, then I absolutely encourage you to reach out to a licensed, highly skilled professional such as myself who can help you, or another licensed, highly skilled healthcare professional. So why does understanding your equipment matter in transfers? I'm going to start this off with kind of a sad story. This was a person that I actually ended up treating back when I was working still in the hospital. And what had happened was a caregiver and their caree during a very simple transfer just from their wheelchair to the edge of the bed had a bad fall. And the reason was because the caregiver had never really been properly trained in how to use the footrest of the wheelchair, or how they should be positioned during a transfer. And so even though they've done this transfer tens, maybe hundreds of times, what happened was the caree, the person being transferred, their feet became tangled in the footrest during the transfer. Both the person being transferred and the caregiver ended up going down in a fall, and unfortunately resulted in serious injuries for both of them. I do not want that to happen to you or anyone that you care about. And so that's one of the reasons why we are going to be talking about this, this basic training, this basic understanding that you need to know today. So the goals of Smarter Transfer Training, Part 3, are that by the end of the session, I want you to understand at least 3 things about common equipment that you may have been unsure about or were previously unaware of. I want you to be able to name 3 things that you can check on your equipment for safety prior to doing a transfer. And I want you to have greater confidence in your ability to use the equipment that you have properly during transfers. So why do transfers go wrong? This is our list we went over in part 1. The things we're going to go over today are highlighted here. Surfaces are too far apart, surfaces are unstable, or devices are used incorrectly. These are all reasons why transfers commonly go wrong. So let's get into it and address that here. So you have to be able to use the correct equipment the right way. Now, part of that is understanding what equipment you need. And I'll be honest, within the scope of this training, there's way too much equipment for us to possibly go over. You can see I have a huge long list here. And this really just, scratches the surface of equipment that is available. We have gait belts, front wheeled walkers, standard walkers, rollators, wheelchairs that are manual, power wheelchairs, bedside commodes with different configurations, toilets, grab bars, shower chairs, shower stools, reclining shower chairs, rolling shower chairs, tub transfer benches, mechanical lifts, ceiling lifts, stair lifts, standing lifts, sliding boards, trapeze, transfer sheet, etc. There are so many pieces of equipment that you might encounter. We don't have time to go over all of them today, but I am going to go over the 4 basic pieces of equipment that you likely see on a very regular basis and absolutely need to know how to use them properly. And those 4 pieces of equipment we're going to review today are gait belts and transfer belts, how to get them on properly, when to use them, when not to use them, the wheelchair and its parts, a walker, and a bedside commode. These are by far probably the 4 most common pieces of equipment that you're going to encounter that you need to know how to use. So let's talk a little bit about the gait belt. It's also called a transfer belt. They're two different words for the same thing, basically. What it does is it creates a safe way for you to actually hold and move and support the person that you are transferring. It needs to be pretty snug to be effective, which can sometimes be a bit uncomfortable for the person that you're transferring. But the risk, if it's not real snug, if it's not on there pretty tight, is that it could slide up during the transfer. And if the belt slides up, then what can happen is it can accidentally produce skin tears or other injuries. And those are by far more uncomfortable than just having it on snugly during the course of the transfer. Some other special considerations for using a gait belt: you should not put a gait belt on over a peg tube, like a feeding tube in someone's stomach. You should not put them on over a suprapubic catheter, broken ribs, other lines, other injuries, incisions, etc. So if you can't use it, those are different scenarios where you would not use a gait belt and you would instead use a different method to move. Ooh, sorry, I can't talk all of a sudden. You would use a different method to move the person from their hips or from their waist. So I have a little video here for you showing the correct way to put on a gait belt, because that is something that a lot of people are never properly trained in and they kind of struggle with. Okay, so I'm gonna first place the belt around the middle of the person, and you want to make sure that it is facing the correct way. So for example, if it's upside down, you'll see that the teeth aren't showing here. To know that it's right side up, you want to make sure that you're going by the teeth here being in the correct position. So then I'm just going to slip the other end of the rope through, make sure that there's no twist or anything behind the back. As I pull it snug, to keep it in that snug position while I'm locking it down, while I'm putting it through the other side to hold it in place, I'm just going to take this other end here and flip it up. And that way it's snug, it's all locked in with the teeth, and I'm free to pull it through that other side. Sometimes what people will do is they won't do that, and so they'll be kind of just feeding it through the teeth at the same time they're trying to feed it through the other side, and it works okay, but it's just a easier, more efficient thing to do, to just get it snug, pull this up, and go through. If you have extra slack at the end, you can just tuck that through so that it doesn't get tangled anywhere, and that's it. Okay, so that is the gait belt. We'll move on now. Okay, sorry about that. We'll move on now to the wheelchair and its parts. I'm not going to talk about the points on the slide here because I review all of it in the video, and it is one of the longer videos. So I'm just going to go ahead and start playing it and let y'all watch. In this video, we're going to be reviewing the parts of a wheelchair and how they work and how best to use them to make sure that your transfers are as safe and as easy as they can possibly be. So we'll start by reviewing the parts of the chair. Here we have obviously the large side wheels that are for pushing independently. They have these external rail on the outside of the wheel in order to allow the person sitting in the chair to push by themselves as much as possible. Here we have the armrests. On this chair, these are removable armrests. And so what that means is these actually will flip out of the way. Now, removable armrests can come in different configurations. A lot of times on older chairs, sometimes they will actually fully remove from the wheelchair by pushing a button in on the front and on the back, and then you lift the whole thing out and set it aside. On this model of chair, and on many newer models of wheelchairs that do have swing away or removable armrests, there's actually a lever in the front that I will squeeze and then simply flip it out of the way. And I'll bring it a little closer to you here so you can actually see what that looks like as it happens. So again, here is the lever. I simply squeeze it and then I flip it out of the way. Now, these removable armrests can be very useful if you have someone that you are trying to transfer who maybe can't come to a full stand, or maybe you are yourself being transferred and you can't come to a full stand. And so it just makes it so instead of having to try and clear the whole armrest with your bottom, instead you can kind of swing right through where that area would be to get to whatever surface you're trying to get to. Okay, the next part that we're going to review here is the brake, and I'll come up here again so you can see a little bit easier. So the brake has this handle right here, and it has a brake on each wheel on both sides to make sure that you're using your wheelchair as safely as possible. You want to make sure that you always have the brakes engaged anytime that you are not moving, basically. And to engage the brake properly, you want to push it back until you feel it click and engage, all right? A lot of times people will feel it sort of contact the wheel, and then they won't go any further because they'll think that the brake is fully engaged. But you want to make sure and push it back fully until you hear that click or you feel it click, and so it's fully engaged and you know that the wheelchair is actually locked. And again, you need to do that on both sides so that one side of the chair doesn't go swinging out from under you and your bottom ends up on the floor. We don't want that to happen. Okay, the next part that I will review for you here are these, the footrests on there. Okay, so footrests come in different configurations as well. And often, this is a standard kind of footrest here. I'll roll it back a little bit so you can see. This is a standard footrest. It flips up and down to help clear the feet. But ideally, if you're getting someone in or out of the chair, or if you yourself are getting out of the chair, you really want to actually remove the footrest entirely. So I'll tell you a little bit more about footrests, and then I will show you how to remove these footrests. So there are some footrests and leg rests that are elevating leg rests, and what those do, usually they have a little calf pad for your place to sit on, or for your leg to sit on, as well as a footrest. And those are great for people who maybe have swelling in their feet. Perhaps they have an orthopedic issue or some other condition that makes it so their feet really need to be elevated or elevated more often. And so you can use those elevating footrests to get some increased elevation of your foot. The way that they come off is pretty much the same almost, whether or not it's a standard footrest or an elevating leg rest or footrest. On most chairs now, you have these two little prongs here and here that the footrest slides over. And then you also have this lever here on the inside of the chair. And you can see kind of here my hand is on. It can be quite difficult to reach when you're actually sitting in the chair. But if you learn your chair well enough, oftentimes people can do it. So what you want to do is you take the lever and you pull it out, and then the leg rest will swing away. Once it's swung away, you can actually lift it up and off of the pegs here, and then set it out of the way before you do your transfer. I really do recommend in general that you remove leg rests entirely, or caregivers remove leg rests entirely prior to doing a transfer. It's just the best way to ensure that no one gets tangled up in the footrests, that you don't have any accidental skin tears or anything like that. So we'll do the same thing to the other side here. Again, I'm going to pull out the lever, it swings away, and I remove it. Now when you want to put them back on, you simply place I'll show you here, place these holes there, back over the pegs, and then you swing it back around. When you swing it back around, you want to make sure that this lever, let's see if we can get a better shot here, let me do it with this one. So back on. There, you want to make sure that this lever on the inside here actually comes around and fully clicks over so that it is engaged, and that way the leg rest doesn't swing in and out, and the leg and the footrest is secure. All right, so I'm going to remove these again though, so that you'll have a better view of the other part of the chair that it is important to talk about. And those are the front casters. So I'm going to roll back a little bit here so I can demonstrate some things for you. Okay, so the front casters are the two smaller wheels on the front of the chair. And they play an important role in being able to steer better, and also the level of stability of the chair. So what we want to do is, if someone is in a working position in their chair, if they're leaning forward, if they're trying to do anything while they're sitting in their chair, then it's always a great idea to have these casters facing forward. And the way you do that, maybe you're going forward, and when you go forward, they're going to naturally flip back. Just go forward a little bit more than you need to, and then back the chair out, and they'll end up in their forward facing position. And the reason that that is so important is because if someone is leaning forward in their chair and the casters are facing backwards, that's going to cause them to potentially tip forward in the chair. The chair itself will actually tip and kind of spill them out. Obviously, no one wants that to happen. And when you have the front casters facing forward, it creates a longer base of support for the chair so that it's much less likely to tip, basically. Now, on the other hand, if you're setting the chair up for a transfer, then you're actually going to want to have those front casters out of the way. So, as you see here, I'm going to back it up. They're going forward, and then to get them to come, there. So to get them to swing back around, you simply push the chair forward, okay? And the reason we want them out of the way during the transfer is because we don't want anything in the way of our feet if we are transferring someone else, and we don't want our feet we don't want the feet of the person who's being transferred to get caught up in those wheels either. We just want the area to be as open as possible so no one gets tangled on anything.
Okay, so next piece of equipment that we're going to go over, and there's another video for this, I promise it's not as long, is a two-wheeled walker. So walkers also come in different configurations. What I'm going to be demonstrating the use of here today is a front-wheeled walker or two-wheeled walker. Again, it's different terms for the same thing. But walkers are also, you can also get a standard walker that has no wheels on it. And of course, rollators that people are often familiar with. And that's the walker that has four wheels and the little seat that folds down for people to sit on, and has brakes, has hand brakes on it as well. If you have a rollator, you want to make sure that you are always locking those brakes during your transfers. And I will go ahead and play the video now. It'll go over the other point for best practice in terms of hand placement for the person being transferred when they're using a walker.
So right now what I'd like to show you is how to properly use the walker or direct someone with a walker to transfer from one surface to another. So let's say that I'm trying to get into this bed here and I'm in my walker. I want to make sure and turn or have the person turn fully inside the walker, okay? And then once I feel the bed or whatever the surface is on the back of my legs, then I can, or you can instruct the person that you're working with, can go ahead and reach back with one hand. We want to leave one hand on the walker here. I'll leave it here so you can show me better. So we want to leave one hand on the walker and the other hand reach back so that that hand that's going back can provide support and the one here can provide support from the front. Now to get up, it's pretty much just the reverse of that. So you want to have the person that you're helping or you yourself kind of scoot forward to the edge of the bed or the couch or whatever surface, the commode, whatever surface they're trying to get up from, or you're trying to get up from. And you want to make sure that the knees are bent a little bit more than 90 degrees so that my feet are where they will be when I stand up. And of course, the reason for that is because your feet need to be able to be underneath you when you stand. If you try to stand up with your feet way out here, it's probably not going to happen. But if you have your feet underneath you when you stand, sort of like if you draw a line straight down from the middle of your thigh bone all the way down to the floor, that's kind of where your feet should be. Then it's very easy to come up to stand, or it's easier. So we're just going to basically reverse that. We're going to have one hand, I'll do it opposite so you can see. I'm going to have one hand on the walker and the other hand is firmly back on the bed so that I'm pushing from the bed, and I have my hand on the walker so that as I transition up, I'm going to be stable on there basically. So I'm going to go ahead and push up 1, 2, 3. And then as I come up to stand, transition the hand that was on the bed onto the walker. So what you don't want to do, what you absolutely don't want to do if you're using a walker to stand up, or if you're helping someone use a walker to stand up, is you do not want them to pull on the walker and have both hands on it. And why is that? Because the walker will tip. It's not anchored to anything. It's very stable when it's loaded straight down. When it's loaded straight down, it can take a lot of weight. But when you pull back on it or push forward on it, or lean forward on it like that, it can tip. And so when someone is either sitting down or standing up and they're really doing more pulling or leaning on it backwards, then there's a chance that it's going to tip and then they will be in, at best, like a fall onto the bed, basically. So we don't want to go like this and sit back and have a kind of uncontrolled fall to the bed. And we don't want to do this and try to pull up. So instead, encourage them to have one hand on the bed, one hand on the walker, and push to stand, one hand reaching for the surface, one hand on the walker, and have a nice controlled supported sit. One more thing about the walker I want to show you here is the way that you have the, that you can fold it basically. So usually there's a button or something here that helps to keep this lever engaged. You're going to push down the button, it will release it, and then that slides in. Same thing on the other side, and it slides in. Okay, and then when you want to open it again, you want to make sure that it's fully clicked and that this is engaged so that the walker is sturdy and the handrails on the walker aren't kind of flying in and out without that being what you mean to happen. So that's pretty much it for the walker.
Okay, and we've got one more here. We're going to talk about the bedside commode, or 3-in-1 commode. I cover almost everything in the video, but I do want to talk about some special considerations for when you are transferring to a toilet or a bedside commode. You always have to keep in mind that this is a more complex transfer because you also have to deal with things like clothing management and toileting hygiene. And those tasks sometimes require extra assistance or a different kind of planning in order to get them done safely. So just something to consider when you're thinking about the safety of your transfers going to a toilet or a bedside commode. And I will go ahead and play the video for you now.
Right now, we are going to talk about bedside commodes and proper way to transfer with them, and also some different aspects of their use, different kind of configurations that they come in. So what I have here with me now is a standard bedside commode. It has two arm rails, it has a little bit of back support here that adds stability, and of course it has the commode portion itself with a bucket. It has 4 legs which are adjustable in height, which you should absolutely use to you or the person you're caring for their advantage, to make sure that it's easy for them to get up and down while still keeping their feet firmly on the floor. So let's talk about how to use it. So obviously you know what it's for. No big surprises there. Some different ways that you might use it, however. So Medicare calls this a 3-in-1 commode, and that's because they say it can go by the bedside, it can go over the toilet, or it can be used as a shower chair in the shower. And certainly depending on the shower, that can absolutely be true, and it can be very useful in all of those configurations. Some bedside commodes, or 3-in-1 commodes, have, instead of fixed armrests, which this is a standard one, it has fixed armrests. Some of them have actually drop armrests or removable armrests. We usually call them drop arm commodes. And those can be really handy for people who are not able to come fully to a stand, so their bottom is not able to clear the arm rail here. And so basically what usually is there's a little kind of push pin or a lever there. You push it in and the armrest will either drop down or fold back out of the way. That way kind of clearing that space so that someone's bottom can swing through and then land on the commode. Some important things to know about the bucket, other than what's obvious about it. A lot of times, if you're using it as a commode that goes over the toilet to add some increased support to get up and down using the armrests, or also to add some increased height to the toilet, it's a really good idea to have a shield that you're using as well. A shield basically looks like a bucket, but there's a hole in the bottom. And the purpose of that is to go down into the toilet so that you avoid any splashing that you would not want on your floor. It's particularly helpful for gentlemen. The other important thing to talk about with the bedside commode is the fact that it's adjustable. So it has these pins on the bottom, and I'll kind of pick this up and show it to you here. You can see they're adjustable pins. The thing to make sure that when you're adjusting the height of this, again, you want to make sure that the person you're adjusting it for is able to sit comfortably with their feet on the floor, so their legs aren't going numb while they're sitting there, and also so they can get up safely, but high enough to sort of allow them to stand a little bit more easily than they would if they were standing up from a lower surface. The other thing to keep in mind for safety, it's always important to double check that those pins are actually locked in, and you want to make sure that all of the pins are even on all sides. It's not uncommon at all for me to walk into a situation and find that the bedside commode's a little wobbly, and lo and behold, it's actually because one of the pins is one peg higher or one peg lower than the rest of the pins, or that the chair is slanted to one side and the pins on that side are slightly higher or slightly lower than the pins on the other side, basically. So it's just a good thing to check. Right now.
Okay, all right, so some other equipment considerations, proper placement to make sure that you're avoiding moving more than necessary. These are things that we covered in other parts of the series, but basically just making sure that you're placing your transfer surfaces together as closely as possible, touching if possible, so that you're not having to move through open space, and so that you are limiting the amount of movement that actually has to be done for a transfer. You want to make sure that the height of surfaces are as level as possible if you're going, from one seated position to another. That way you're not having to try and travel uphill to get to a surface. As much as possible, you want to go even or try and go downhill so that gravity is your friend and not your foe. You want to make sure, as I said in the video, that your equipment with adjustable height is properly set for the needs of the transferee so that you are increasing their ability to participate, but still allowing them to have their feet on the floor
And again, I cannot emphasize this enough. Make sure to check that all of your equipment that has wheels has the brakes firmly locked before you initiate a transfer. So the wrap up for today, proper use of the appropriate equipment can really make all the difference in terms of making transfers easier and safer. If you're using the right equipment safely, then you're preventing unnecessary lifting, which can prevent unnecessary injuries. You're decreasing the physical demands that are placed on you. You're encouraging the participation of the person who you are moving, who you're helping to transfer, and increasing the confidence for both of you. So if obviously this was a basic transfer training series, there are definitely lots of advanced transfer training topics that were not covered here. Things like mechanical lifts, sliding boards, all that other equipment that was listed in the previous slide. Special or complex medical conditions or impairments can sometimes require more advanced transfer strategies. Transferees who have limited trunk control or balance or significantly impaired cognition may sometimes need additional strategies. The basics that we covered in parts 1, 2, and 3 are absolutely going to be invaluable in pretty much any situation that you are in, but some situations require a little bit more technical thinking or slightly different techniques sometimes. And if someone has very limited trunk control or balance or impaired cognition, then sometimes they require some slightly different strategies. Transferring people who are not allowed to bear weight through one or more limb can be complicated and require some different kinds of training. Or using different kinds of complex durable medical equipment, DME, also generally it requires some more advanced training. Certainly, if you are having to provide transfers with multiple caregivers, that is also a scenario where some additional advanced training is advisable. So if you need more of that advanced training, if you need individualized or custom solutions, or you need staff training, please feel free to reach out. You can call me or send me an email. I would be happy to set up with you a free consultation to talk about your needs, talk about your goals and what you're hoping to achieve, and ultimately provide the best recommendation, the best customized solution for you to get your individualized training needs and goals met. If you want more free tips, then you can certainly access those through my website. You can go to my website at www.aipctherapy.com/transfer training and sign up for my video newsletter there, where you will receive regular emails with videos that demonstrate different things, different aspects of transfer training to help you be safe and help your client or the person that you are transferring be safer and more independent as well. If you have any questions or concerns, comments about the presentations, particular concerns individual to you or your situation, please feel free to reach out. Give me a call at 469-998-1245 or send me an email. I would be happy to respond to any questions or comments and ultimately help you find the right solution for you. Also, thank you to Kathleen and Seniors Blue Book. Thank you so much for hosting this series. It means absolutely the world to me to be able to share this knowledge with people and hopefully allow them to be safer, allow them to foster independence in the people that they're caring for, and allow them to live with less worry, with less safety concerns, so that they can keep living their lives and keep helping people the way that they do. So thank you so much for hosting this. I really, really appreciate it. It's been an absolute privilege to do this with you. Again, if anyone has any questions or concerns, if you need more advanced training, individualized training, or staff training, please don't hesitate to reach out or email me. You can request a totally free consultation where we will discuss your needs, your goals, and come up with specialized recommendations customized for you to get you what you need. If you're not ready for that, but you just want those free tips, don't forget to visit my website and sign up for the free video newsletter. And until I talk to you, until next time, thank you so much for watching. Kathleen, thank you for having me, and everyone take care.
Thanks, Emilia. Really appreciate it. Can you tell us a little bit about some additional series that we're going to be doing?
Oh, with you at Senior Blue Book?
Yes.
I don't know what additional series are we going to be doing at Senior Blue Book. Whatever you want, Kathleen, I'm here for whatever.
That sounds perfect. Well, there's more to come. Thanks, everyone. Thanks,
All right.
Emilia.
Come on. All right. Bye.